There's been a lot of talk lately about rebuilding trust in the NDIS. Unlike others, I don't think we're all cool bananas. Firstly, I think we need to break down the walls of the invisible institution in society. Disability needs to work across all of government. No more every time you go to a state department being told that's a federal matter. We are a square peg in a round hole in society. We need to end NDIS segregating disability in education and have support workers in schools, employment access, public transport, and building access. And we need to see representation in society, access to employment, new employment arrangement. Instead of grants of bribes, we could employ a carer and a person with a disability together so the employer gets the advantage of two staff. Let's remember our over 65s as well. This is a human rights issue. Healthcare and disability is the next thing we need to look at. The NDIS and our hospitals need to work together. We need to change the face of healthcare. We need healthcare, not hospital care. We need to support primary care in the community so people can rebuild relationships with their GPs. We need to have support workers and carers able to go into hospitals. Safeguarding. First thing is communication. There needs to be some. There needs to be a national safeguarding framework, not just something that takes care of the 10%. We need to look after the other 90% of people. We need a national system with disability commissioners with a national oversight. We need to strengthen our workforce, support workers' registration, with job security and grants, promote secure employment, training that's fit for purpose, elevate the workforce, end the exploitation and end the abuse, safeguard our workforce. How does it feel to be undermined by being well qualified and having others paid next to you the same, but totally unqualified? Workforce burnout and workforce failure. We're facing workforce failure in this industry. Why don't we remember our 2.6 million carers out there? And when we say we have a skills shortage, let's mine that resource. Build the client journey. Test it. Does it work? Does it work for support workers? What are the roles? What should the qualifications be? What are the competencies and the compliances? There's far too much confusion as to who does what. Nobody understands the process anymore. We need independent advocates in every plan. Most advocates are systemic. We need provider resilience. Fix the registration debacle. One-man bands are okay for single clients, but not for multiple. The SHADS Award. And untouchable clients, safeguarding staff, incentives to employ disabled people. Imagine with the SHADS Award, you have to pay somebody 2 hours to be there and the client only wants half an hour. That client's not going to be able to get service. And there are far too many clients who are labelled as difficult clients. And in the industry, the bigger providers just simply don't take them on. Those people end up in hospital. We need to do something about that. The next thing is KISS. Keep it simple, stupid. For goodness sake, let's just remember that it's just become far too complicated a process. It just needs to be simplified. And lastly, COVID and quarantine. By stopping the quarantine period for COVID, it hardly demonstrates trustworthiness and inclusion and showing us that all people are valued in society when you're prepared to devalue the feelings and the immune compromised and those people that are extremely vulnerable to COVID. We need to reverse that. Anyway, that's my 2 cents worth as to what things I think would go a long way into rebuilding trust back into the NDIS. Other people, other advocates out there, better than me, have had town hall meetings online, and there is a webpage where you can go and put your name to it and sign up and state how you would very much like to see the quarantining revert. Thank you very much for your time. And please go to carersandadvocates.com for more.